Welcome back, peeps, to another episode of the Tooth Earner podcast, Peeps with your peep, Irene. Hello. If you're watching this on YouTube, hello, welcome back. If you're driving to work or in the car or wherever you may be, hi, I hope you're having a great day. Welcome to another episode recording live at the Chicago Midwinter Conference with a good friend, Karen Davis, who I believe is now an even better friend after having this podcast interview with me. We got to sit down and it turned into a one-part episode to a three-part episode, and I've put the last two parts together, so you'll have to listen into those next week. But in the first series, or first part of this episode series, we talk about Karen's journey in dental hygiene, where she got started, what it's like being a hygienist in the 80s and 90s on an airbase, what the uniform looked like, and then what are some of the similarities or differences between practicing back then and practicing now. This episode was kindly sponsored by friends at Designs for Vision, who are doing a 45-day trial of any of their pair of loupes. You can be measured, get them prepared, ready, sent to you, and try them for 45 days. And if you don't like them, you can send them back. So I feel like that is one of the most amazing things about this company, is that there's, no strings attached on that side. So I highly encourage you to try out their loupes. I think that came up in the episode quite a bit too, on the differences between practicing now and practicing then, and like the availability of having more technology like loupes to better our careers and better our practice. So strongly encourage you to check that information out in the description below and listen to this episode and have fun. We definitely had a little bit too much fun. One of her funny stories of how she got a handpiece stuck in some guy's fabulous mustache was just wonderful. And yes, that is it. That is all. Thank you, Karen, for being part of this series with me, and thank you for sharing your message. So until next time, peace out, peeps. So I'm happy that we got to do this.
Me too.
And I want to learn more about you, like the person behind the podium. I know you're speaking here, and we'll get into that on the part 2 of this series. But tell me about you. Let's go way back. This is pre-dental. I want to see how much I can get out of you.
Oh, wow.
Where'd you grow up?
The reveal,
yeah.
Okay. Well, no surprise with my Texas accent. Okay. I'm a Texas girl, born and raised.
Okay.
So funny. First time I ever spoke in Boston, I got some critique. I don't like your accent. It's
my gosh.
What accent? I don't have an accent.
You have an accent, Boston.
There you go.
Oh, my goodness.
But yeah, I grew up in Texas at a tiny little town called Electra, Texas.
That's a cool name.
It is a cool name.
Yeah.
And there were 4,000 people in the city when I grew up, so it was kind of magical. You knew everybody. You got to ride around on your bicycles all through town, and it was totally safe.
Okay.
And then I had 63 people in my graduating class. So,
wow.
Of course, we knew everything about everyone. And I didn't really know anything different about the world at large. I just loved growing up in a tiny little town with a great family. I have an amazing family, 2 brothers, 1 sister.
Okay.
And so life was good, but I decided I wanted to spread my wings a little bit. So I knew I wanted to do dental hygiene, and that's an interesting side story.
Okay.
And I'll just divert for a second. I'm literally in the 7th grade.
Okay.
And there is a mobile unit that comes to my junior high in tiny little Electra, Texas.
Was there no dentist in your town?
No, there weren't.
No, okay.
Not at all.
Okay.
But there's this mobile unit that comes from Texas Women's University, and they are showcasing opportunities for careers.
Okay.
And you walk into this little mobile unit, and there was a little dental hygienist area, there was a nursing area, there was a radiology technology area, med tech area, and I'm walking into this little mobile unit, and all of my friends are just, playing around, and I'm thinking, this is what I want to do.
No way.
Yeah, absolutely.
Wait, so they had mobile dentistry?
No, it wasn't mobile dentistry. It was literally just a traveling unit to showcase career choices.
Oh, okay. So they weren't practicing.
No,
okay, got it.
No, but I knew immediately when I walked into that mobile unit, I wanted to do something in healthcare.
Yeah.
I always liked sciences, and my own dental hygienist was just kind of one of my mentors. And so when I go back to see her the next time, I said, So tell me a little bit about dental hygiene. And she's like, oh, it's the best career on the planet. So she just sold me on it. So I knew
In 7th grade.
I knew in 7th grade that I wanted
That's
to
crazy.
pursue dental hygiene.
Did you know anyone that was in dentistry at the time?
Not a soul.
Just your dental hygienist.
Laura, my dental hygienist, yes.
Oh my
that I love.
goodness. Interesting.
Yeah.
I don't think I can even think back to when I realized I wanted to do dental hygiene.
Yeah. So I knew early on that I wanted to pursue that course. So, I mean, I kind of grew up in a magical situation with a great family, great town. Went to college my freshman year out of state because I just wanted something different. But they did not have a dental hygiene curriculum in that university. So I applied to the university back close to where I grew up in Wichita Falls, 30-minute drive. And I was accepted, so I actually moved back in with my parents.
How's that? How did that
It's
go?
a little awkward after you've graduated from high school. You've spent a year as a wild freshman, and then you move back in with your parents.
Yeah.
It was, but the
Were
really,
you a wild freshman,
was a
though?
wild
No way. Seriously? Oh, my God. We need to go back to that. Okay, I want to know what kind of high school kid you were. Like, aside from, like, being brainy. Okay, so this is what I'm envisioning. I'm envisioning you to be, like, perhaps a cheerleader.
I was.
Okay. Did you date someone off the football team?
I did.
Just stop. I can't. I'm sweating. Oh my God. My mother would be so proud of me right now, my premonitions. Okay. So I envisioned that you were like the cool kid and like had all of the friends, but you were really sweet, but had a devious side.
Bingo.
Shit.
Is it really that obvious?
No, because you know why? Because now I feel like I am the complete opposite of what I was in high school. I was like the quiet nerd.
Yeah.
And now I'm not. But I
Right.
feel like anyone now that is doing kind of what we do, they
Yeah.
must have had like an opposite side to them. Because when
I
I look
totally
at you,
did.
you're very like, or maybe this is just what I feel. I feel like you're just, you have your shit together. You're this like little package of wonderfulness. And like you've got the right attitude and the right people. You say the
Oh
right
my
things.
gosh.
So you must have been the wild child when you
I
were a
was
kid.
totally the wild child.
Oh my God, that's so cool.
I smoked cigarettes. I smoked pot. I drank beer.
Stop.
Oh my gosh, yes.
Oh my
Well,
gosh.
think about this. You're growing up in this tiny little town.
Yeah,
What is there to do?
nothing.
You have keg parties. That's what you do on the weekends.
Where do you get the kegs from?
You know,
Whoever.
all of the liquor stores around there would sell it to underage kids. They didn't care.
Oh my gosh.
And then you always had older age kids that were friends. So,
Right.
yeah.
And brothers and sisters.
Yeah,
And,
yeah,
okay.
right.
All right.
Yeah.
So then you went to high school and then you went to college.
Yeah, and I took that wildness to college and
Okay.
didn't quite have it out of my
Where
system.
you were just sorority sister?
No. I didn't do sorority at
Oh,
all.
okay.
No, didn't go that
I was
route.
wrong.
No, I just continued the partying every
Okay.
chance I had. But here's the rub. I had already figured out I wanted to get into dental hygiene, so I really...
You had to work hard. Was it
really-
competitive?
Yes.
Okay.
Yes, when I was applying, hundreds of people would apply for a 13-seat slot. Hundreds.
13.
Yeah, we had 13 in our class.
Wow.
Yeah.
That's a really small class.
Yeah,
That's like
it
a
was.
great ratio.
Yeah.
It's unheard of these days.
I know.
Yeah.
I was really blessed.
Yeah.
So I really had to buckle down. So I really had to kind of split my time between partying and really studying.
Sure. And it was was it associate's or bachelor's degree program?
It was
Bachelor's degree. So 3 years or 4 years. I mean, every school's a little different these
yeah,
days.
I had my first year of
And I'm Canadian, so it's
prerequisites-
different in Canada.
Right. Yeah, I had my year of prerequisites in Oklahoma, where I went my freshman year, and then I transferred to the dental hygiene program, Midwestern State University, and I got my associate degree, and then stayed on and got my bachelor's degree.
Cool.
3 years.
Awesome.
Yeah.
Okay.
Mhm.
And then what? So you graduated
Well,
from high
so
school.
I mean, I really buckled down when I went into the dental hygiene curriculum. It
Yeah.
was so strenuous. I was really not prepared. So here's a fun story. The director of the program, when I was in dental hygiene school, the 1970s.
You were in hygiene in 1970? What was hygiene like in the 70s?
No, I graduated
Oh,
in
you graduated.
1979 from
Okay.
hygiene.
Okay, so
school.
80s. Let's call it the 80s.
What was it like?
Yeah.
White dress,
Okay.
white hose,
Okay.
white shoes.
Like pantyhose?
Yes.
Stop it.
Yeah, yeah.
Okay.
Yeah. Thick white pantyhose,
Okay.
white dress, white shoes, white pantyhose. Get this.
Did you have
Hairs
cap?
up, white hat.
Stop Do we have a photo of you with us? Can we use this on our Instagram, please? Do you
maybe
have a picture?
I maybe can find one.
We need to like
And
a
I had-
then and a now. We need to get one of you now in like a
And I
gown,
had like
an
this-
N95.
No, I had an afro. I had an afro.
Stop.
Yeah, I did. I had an afro.
That's
And then I
funny.
would put my little white hat on top of my afro.
Did you have to clip it in? Like how does
Sure.
it stay on
No,
when you're
no,
like
no.
upside down
No,
in someone's
you
mouth?
You have to clip it on.
Wow. I find it fascinating when I hear stories about people that practiced, that
Mm-hmm.
still practice now, and that are like, you know, have evolved so much. Like technology has changed so much.
Oh, there's nothing I do today that I did when I was in school.
Of course
No,
not.
It's
like
all
you probably
100%
for the better
different.
part of
Yeah.
your schooling like barely wore gloves. So I feel like
I wore them in school, but when I went into the real world, nobody wore them. So I
Right.
ditched them.
it's like the safety glasses pre-COVID. Like in school,
Correct.
everyone had to wear safety glasses,
Sure.
but then you leave and you're like, you got the beautiful eye makeup. And I see the pictures on Instagram. People tag me, and I'm like, girl, where are your glasses at? Like,
Right.
cover that hair up a little bit, just a little bit. Like it doesn't, you know, the bangs in the eyes.
Yeah.
I feel like a lot of that happens. What other things would you say that you did in school that are really different now? Like, is there one thing that just
Yeah.
blows your mind?
Yeah, and it's a funny story. So I was treating airmen in my dental hygiene curriculum because
Airmen, like in the Army airmen?
Yes.
Okay.
Yes. Because
I'm just envisioning you in this like fabulous white
Yes,
outfit with these
exactly.
like gorgeous men wearing these like
yes,
wonderful
you've got
uniforms.
the right picture. You've
Oh
got
my
the
god,
right
I want to go
picture.
back to the
Yeah,
80s.
Yeah, exactly. So we did not have
It's like
a dental
Tom Cruise just strolls in.
pretty much
Stop.
all day.
Oh my
all day.
goodness.
Yeah, it was great.
Did you marry one? I hope you
I
did.
did not.
Damn
I
it.
did not. No. So we're in the Air Force facility using their high-tech equipment because we did not have a dental hygiene facility on
Okay.
campus. So we would do all of our academics on campus, then we would drive to the Air Force Base, and then we would treat our patients at the Air Force Base. So one of the things that happened to me early on that would never happen now because I don't even use a polishing device. I use airflow device for everything.
Amen.
So early on, I am treating an airman, and he's got this like walrus mustache that's just everywhere. It's everywhere. You see where I'm going with this?
Is it like the mustache from what's the guy's name in the movie? It'll come to me. It'll come to me. Keep going.
All right. So I'm parting it to get it out of the way so I can even get in his mouth to work on him. Really never seen anything quite like it before. And so I do all of his treatment. I'm winding down to the end of the appointment. I'm polishing him. And all of a sudden, it's like,
It got stuck in his mustache.
Oh, yeah. Oh, yeah.
Stop.
yeah, no. And I'm a dental hygiene student, and I don't have a clue what to do.
Yeah.
So it's like, and I'm just frozen. It's like, what do I do?
What did
And
you do?
he goes, put it in reverse.
Oh yeah, smart.
I said,
Is there a
What?
reverse? Was
Yeah,
there a,
I didn't
oh.
know that.
Oh,
Was
okay.
it-
It's like the little flip on the motor.
Mm-hmm.
Okay.
obviously this had happened to him before. So he knew exactly what to do. So I put it in reverse and, I unwind myself. And I'm so flustered that this happened
No.
that something else happened to make it even
Oh,
worse. So I
no.
finish his appointment. I'm saying to him, I'm so sorry. And I pushed the wrong button
Oh,
on the
no.
automatic chairs at the Air Force. I don't know why they had this in the dental.
It's like an eject button?
No, it was a button where the head goes down to the floor and the feet go up to the ceiling.
From Bellenberg?
Yep. Mhm.
Oh my
So,
god.
and it's an auto
So-
button. So if you hit it, it just goes. So after that happened, then he's heading toward the floor and I'm just following. I'm so
You're like,
sorry.
I'm so
I'm so sorry. I'm so sorry. I'm so sorry.
Oh my goodness. The poor guy's just like upside down hanging by his ankles like a bat.
It was awful.
Is that one of your like greatest memories?
It's
of
one
that
my
time?
worst memories. Oh my gosh, I can't even believe I put him through that.
Oh my
but
god, mustache man. I can't
Yeah.
imagine there's an actor that has like a really big dusty looking
yeah,
mustache.
it was enormous.
Yeah.
It was enormous, but
That's too funny.
so I don't even use a polisher now, so that would never ever happen to me now. But
I feel like his mustache has to be that long.
oh, it was.
So I can't.
Yeah.
I've had my
Yeah.
like a burr. I'm a restorative hygienist, so I do like fillings and stuff
Yeah.
too. So I've had a burr get stuck in like a rubber dam or in
Sure.
an Optragate, and then it's like,
Yeah.
like, you know,
I
it
know.
rips right through it. But I've never thought about it getting stuck in someone's hair.
Yeah,
Oh.
right.
Oh my goodness. Okay, so then did you work on the base? Like,
I did.
okay.
Yeah,
What was that like?
Oh, it was really cool. It was really cool. You have to have all this clearance to go on the base, so we had to all get approved
The little
as these little
badges and
dental hygiene
things.
students. Yeah, yeah.
That's really cool. So
was
then
great.
what did you do after that? After you graduated and first job? Do you remember your first?
Oh, absolutely. My first 2 employers were amazing.
Yeah.
Carl Davis,
Okay.
no relation. Carl
Okay.
Davis was the pediatric dentist that I accepted my first position with. And I knew nothing about pediatric dentistry, but he hired me as both an assistant and a dental hygienist. So I got to assist him with hospital dentistry, which was
Cool.
really
Like
interesting.
sedation stuff?
Yeah, interesting and tragic all at the same time
Yeah.
to see these tiny little children just bombed out mouths.
Yeah.
But I learned so much from him, and he became my mentor. He was just the kindest man, and I really loved working with children, but I did it until I had enough, and then I
Yeah.
wanted to see adult patients. So I actually started part-time with Carl Davis, and then I eventually went to part-time with an adult dentist, Dr. Grimes. And Dr. Gary Grimes said the most infamous thing to me one time. So I'd been with him a few years, and he had this Texas drawl. He wore cowboy boots to the office. He smoked cigarettes. Yeah, it was just crazy. So he pulls me in his office one day, and he sits down at his desk. He's kind of relaxed there, and he goes, "Karen, I need to tell you something. You can't save the world from periodontal disease."
You can't. You just can't. It's not possible. And what did you say?
I said, "I can try."
Oh, you were so sweet.
I mean, I already knew early on in my career that periodontal disease was just wrecking people's oral health
Yeah.
and their overall health and their confidence with their smile and everything. So that really became a passion of mine early on. And so I really fit right into just everything about education for
Yeah.
patients, then for colleagues. It was just a really easy, natural fit for me.
So, I mean, I hate to fast forward and then backtrack, but you've spoken on like every stage possible in dentistry. You've written for every publication. You've done research, correct?
Yeah.
You've done a lot. And I always wonder, like, where did that come from? Like, you know, I don't know much about you as a young human being, but you strike me as someone that was ambitious and that didn't give up. So
True.
when did you say, okay, well, I've done pedo, I've done perio, I've
Yeah.
moved to perhaps states and practice in different places. What was your motivator to take a stage? Or do you remember
I do
what your
remember.
first opportunity was? Like, what was that first thing that presented to you? You were like, I'm going to say yes to this and figure it out later.
Well, it's interesting. There's a little bit more to it than that. I actually graduated dental hygiene school. My instructor was really, really active in her professional association, Kathy Trilly, just an incredible friend, mentor of mine. I will always be grateful that she had the bar so ridiculously high as a clinician in education that I really carried that high standard and high bar into my professional involvement. And I just really followed in her footsteps. She was active in the professional association. I quickly became active in the Texas Professional Association. I attended a lot of meetings, and I remember sitting at a meeting very clearly in Dallas, probably my first year into practicing on my own. And it was at an AAP meeting,
Huh.
American Academy of
Yeah,
Periodontology.
yeah.
They were meeting in Dallas. I went to it. I was still living in Wichita Falls, but went to it. And I walk into this room, first time I've ever been to a professional meeting, and the topic was insurance, believe it or not. So,
Insurance.
yeah, it wasn't a really compelling topic.
That's how long ago we've been battling this topic, huh?
That is correct. Yes.
Interesting.
Yes.
Fun.
So I walk into this room, and there's somebody at the stage, and she's talking about insurance, and she's making it really interesting. And I remember thinking...
Insurance is
Yes!
interesting? Okay.
Yes. And I remember thinking,
Wow.
that looks fun. I'd like to do that someday. And that thought just kind of was in
How
my
old were you?
mind. I was, I graduated. I was in my early 20s. I was probably 24.
Okay. Okay.
That thought just went in my
Which
mind.
is young for a speaker.
Yeah.
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 Okay.
So I didn't pursue it at that time. But when I moved from Wichita Falls to Dallas, and I accepted a job in Dallas, I accepted a job where in the practice that I'm still in
No
today.
way. How many years have you been
I
there?
started there in 1985.
Stop. It's the year I was born. 38. Almost 38 years.
Yep. Yep. So we're
Wow.
growing old together. My patients and I are just growing old together and doing life together.
But you're
It's been
not. They're
incredible.
not only growing old with you. They're seeing the generations. Like you're probably
Yeah.
seeing their
Oh, for sure.
children and their children's children.
I am.
That is
It's-
really cool.
It is. It's great. But the fact that I accepted the job in this particular practice is really what helped set me on my path to speaking. Because
Yeah.
when they interviewed me, the office manager said, "Now, Karen, you're taking Nancy's position." And Nancy always did hygiene breakouts when Dr. McDougall would speak. He was already a speaker.
Okay.
And he was doing continuing education. And so many times when he would host programs in Dallas and dental practices would come to Dallas, Nancy would do the breakouts with the dental hygienist while he's doing a breakout with the dentist. And she said, "We're going to want you to do that. Is that okay?" I said, "That sounds great. Tell me what I need to do."
So what's a breakout?
I know. So I had an opportunity literally with that
Hand
first
it to you.
position I took in Dallas to fit into an opportunity to connect with other colleagues and teach them some of the things that we were doing in our practice that
Yeah.
they were interested in. One of the reasons I'm still at this practice, it's a phenomenal office. It's like a family, and
Yeah.
it's very cutting edge, and he's a great leader. And so we did a lot of things right. And not everything, but we did a lot of things right. And so it was fun to teach some of those concepts to dental hygienists that would come from all over the country. So that was kind of my exposure to a little taste of what I thought I was interested in, that very first meeting that I sat in about dental insurance. And from that, then when Nancy came back from Switzerland, she worked over there a few years, then Nancy and I, she came back to the practice. We decided together that we wanted to start some continuing education programs.
Cool.
Yeah.
Is Nancy still speaking?
No, Nancy has passed.
We're sorry. Sorry for that.
I know. But we were great friends, and we just kind of set up our own continuing education programs.
That's cool.
It was. And
Yeah.
then I also went to work for JP Institute
Okay.
out of California as a part-time consultant. So that also really kind of helped forge my opportunities for speaking. So I quickly just stopped what I was doing with Nancy, put my energy in with JP, and through that, then I was speaking at dental conferences and meetings, and then I really did not start my own company until 1999.
Cool. Wow. Interesting. I guess, and then it's like people ask that question often, like, how do I start speaking? And you kind of just, like, you just
Yeah.
start. You find a
Early
way.
on, I spoke at study clubs for
Yeah.
no fee at
yeah.
all. Just
yeah,
to
we've
get
all done stuff for
opportunity.
free.
Yeah,
I
of
mean, hey,
course.
sometimes we still do it. It's
Of course.
just like you.
Yeah.
It comes with the territory. But it sounds like your office had something figured out. It's like trying to connect
did.
people together, and
Yeah.
maybe that's something that someone could do with their doc in their office. Like hold your own little itty bitty study
Absolutely.
club.
Yeah.
With some local people.
Invite other colleagues, invite
Yeah.
them to come over and take on a topic that you're passionate about, that
Yeah.
you're interested in, learn about it,
Yeah.
and then learn how you can share that
Yeah.
with colleagues.
Someone once told me when I asked, like, how do you become a speaker, like many years ago, and it's like, speak until people listen.
It's
And
actually pretty good advice.
It was. I thought it was really good advice. Like, speak until people listen. I'm like, well, when will they listen? And it's like, when you just keep doing it and someone will listen eventually.
Right. Yeah, no,
so
that's true.
That's cool. What would you say one of your most like memorable career goals has been?
Wow.
Like, is there one thing that you're like, that was on my career bucket list?
Well, as a dental speaker in the U.S., you need to make all the major meetings.
Right.
Yeah.
At least once.
At least once.
Yeah.
Yes. So probably the first year I did what's referred to as the trifecta, and I do not remember what year this was. So
What's
don't
the
pin me.
trifecta?
Oh, the trifecta is you speak at the Yankee,
Okay.
then you speak at the Chicago Midwinter,
Okay.
then you speak at the Hinman.
All in the same year.
Yes.
Oh.
Yeah.
Damn. I
Yeah.
haven't hit Hinman yet.
Yeah. Oh, it's a fabulous
I don't think I've
meeting.
done. I don't think I've done any of those. I've done the Chicago Midwinter and Yankee.
Yeah.
Not in the same year though.
Yeah. Yeah, so, I mean,
That's so hard, though.
It is.
As
it
an-
is.
Yeah.
Yeah, it's
As a
Yes.
hygiene clinician, and like no disrespect to any of our other colleagues, but that's really hard as what the speaker world considers us to be an auxiliary still on the podium.
correct.
I feel like there's still a long way to go. How do I politically correctly say that without never speaking at any of those events
so
ever
funny.
again? But it's
Well,
true.
it is
I
changing.
mean, there are
It is
fewer
changing.
speaking spots
Yes, there
for
are.
us because there are fewer that attend. But I think that is slowly changing. I
is.
wish that more doctors or practice owners. I'm a practice owner, not a doctor,
Yeah.
and I fall into this category too. I wish that more of us owners would bring our team members.
Right.
The unfortunate part is that, it's super expensive to fly people across countries and hotel rooms and food and all of that stuff.
Of course.
But I think sometimes it's just too easy to say, no, it's too expensive, instead of saying, yes, it's expensive, but let's come up with a plan.
Yeah, because the fallout of that is the times that our office has collectively gone to meetings together.
Yeah.
That's where we get the biggest bang for the buck.
Yeah.
Truly, in terms of what you come back with and what you implement.
Yeah.
If everybody can have that same exposure,
We're all speaking the same language.
I would say every couple of years that should be a goal.
Agreed. Totally. Cool. Well, let's go into our part 2, because now we know a little bit about you. So stay tuned to part 2 of this episode with Karen Davis about her speaking topic here at Chicago Midwinter.